Hello, everyone. Good morning. Thank you for joining us today. My name is Stephen Gutsoyan. I am the Assistant Director of Alumni and Family Relations at California Lutheran University. I just want to go over a few housekeeping items before we get started. If you have any questions during the presentation, please use Zoom's chat feature to ask those questions. We will be monitoring them throughout the presentation, and there will also be dedicated time for Q&A at the end. When you joined the meeting, your video was off and your microphone was muted. There is no need to change these settings during the presentation to avoid excess noise or any disruptions during the presentation. Last bit, this presentation is being recorded, so it will be posted on our website and will be sent out via email after the presentation for your reference. Now it is my pleasure to introduce our presenter for today. Jamshid Damooei is Professor and Director of the Economics Program in the School of Management at California Lutheran University. He also serves as the Executive Director of the Center for Economic and Social Issues. Dr. Damooei has served as the Director General of the Department of Economic Studies and Policies of the Ministry of Economic Affairs and Finance of Iran. He then headed to the Economic Section of the United Nations Field Office in Somalia. After returning to California Lutheran University, Dr. Damooei's scholarly work included a broad spectrum of current social and economic issues, such as project design and evaluation, methods of capacity building during times of crisis, crisis prevention and recovery, causes of economic imbalance, aid coordination, privatization of industries, monetary and financial problems, and economic and social impact and assessments of policies or institutional establishment. Today, Dr. Damooei will be presenting on the future of caregiving for an aging population in Ventura County. So with that, I will turn it over to Dr. Damooei.
Good morning, and thank you, Stephen, for the introduction. I'm very glad to be here and talking to you. Let me just give you a little background about this study. I started this study some year and a half ago. I was invited by the Ventura Community Foundation to work on their caregiving studies. I was quite actually surprised myself as I got myself into it, and I started putting some information together. And a lot of questions actually kind of came to my mind, which I tried to share to the extent possible today with you. And since I do not have the command of changing the slide, I'm going to be using the term next or let's go back. And Stephen is helping me with that. Next. This is the agenda that we have for today. So a glance at the demographic changes, how far this glance goes. It goes right up from where we are to about 2060. So we see that how these changes are there. Just the highlight, which I brought here, then I will show them with the numbers, that we have a shrinking support for caregiving. So if it's something for us to think about, we can think about how we deal with it now, and then we kind of extrapolate that in the next 10 years, 20 years, 30 years, or 40 years. I will be talking a lot about cost, and I like to really take my time and be very deliberately explaining what exactly cost is in economics. And unfortunately, I see that most of the time we just skip over this issue and don't really pay enough attention to it. And then maybe highlight what is the agenda or what are our tasks for the future. Next. This is a projection. This is a projection of the, this is actually for Ventura County, done it for the state of California. Quite honestly, if really what you see here, I can assure you that you can see the same thing in California with a little change, and the same in many other places. So put it succinctly and briefly, from now till 2060, the greatest growth in population is in ages 85 and plus. 85 plus will grow about 300% roughly. And the number of kids, or in fact the growth rate in kids, will shrink about 13%, about 12.7 as you see in the graph. Again, put it in a way that can be easy to follow is like this. And about 40 years from now, for every 2 children, we have 1 person who's 85 years or older. Next. This is what we call support ratio. The definition of the support ratio, you can see it on this slide. And it's when you take the number of people who are age 45 to 64, and then you divide them by the number of people who are 80 years or older, you get what is called support ratio, caregiver support ratio. Right now, we are about 6.5, which is quite good. So in other words, we have about 6.5 people in the age category of 45, 64 for every guy who is 80 years or older. But not so many years from now. 10 years from now, that's almost shrink to about half, 3.4. And about 20 years from now, we kind of going towards the ratio of 2 to 1. And so if you really see how fast the caregiver support ratio is shrinking, the rate is really alarming. Next. So what are these people that need caregiving? More than 3/4 of them actually in their home. About 16%. By the way, all the references, all the sources are in the bottom of every graph that I present. So I'm sure that Stephen will put that on the alumni and family relations website so you can have access to that, so you can check it out. There's also at the end, there is a link to actually the study, which has been published by VCCF recently, and you can also download a copy of that for yourself. So anyway, going back to this slide, so we have about 16% that are with the family. So like, for example, somebody taking care of their parents or, others who need. And about 5% of them are what we call in kind of institution, in senior, community, or nursing home. And that's the picture that we have. It's 2017, so it's quite recent. Next. So this is the, so who actually is taking care of people who need care? The share right now, the lion's share of this is with the millennial and with the baby boomers. And it's a significant amount also on Gen X. What we call mature means really much older, but they take about 7% of that. This is a kind of shifting situation, and it will change very fast. In fact, the baby boomers will be in the category of those who need cares, and the millennial are the one who are actually giving, and the Gen X. Next one, please. Okay, in this study, when I was kind of looking at what are the needs, what are the escalation of the needs, because when you think about future, part of that is how well prepared we are for the future. And quite honestly, in many areas of the study that I've done for the last 20, 25 years, the last 20, 25 years, I really focused my study on what I call economics of social issues, because I realized that the study of economics, if it doesn't have a human face, which is now really should be called face of life, really doesn't have any meaning. So this is where I kind of changed, and I really became much more focused on this type of study that has that kind of face of the life. So what is happening here from now till mid-century? The number of people who have Alzheimer's, suffer from Alzheimer's, will actually increase dramatically. So if you really see it, even in 10 years from now, we're going from about 5.8 million to about 8.4, and that will escalate even sharply as you see it in this graph. So are we really preparing ourselves for that? Are we taking care of ourselves in the years to come? Next. This is the share of the patients of Alzheimer's disease. So everybody knows it's really a disease or a problem of old age. Some small portion actually may have a very early onset of this problem, but it is primarily, in the ages of 75 and higher. Next one, please. So this is the direct cost. Let me just talk a little bit about cost. Open it up the way that I really like to open up cost, because I realize, in my work as an economist, that cost is often misunderstood. Okay. Cost, part of the cost is that what we pay. Let's say that the flow of money out of our pocket. Let's call it direct cost. Another part of the cost is that we bear, we tolerate. We do not necessarily pay for it, but it is happening. I want to talk about that, and that's really a complex part of it, because part of these costs is if you really give up certain hours and you don't work, you can measure it, because this is the number of unpaid work. But the costs go further than that. Cost may impact our psychological, our emotional, the way we feel about ourselves, others. And if really one aspect of that, there are so many aspects of that, but one aspect of that, it is what we call productivity, and we put so much emphasis on it. How does it really affect our productivity? That's another one. But I don't want to really give up on cost concept till I really explain that more. Another part of the cost is the escalation of the cost in the future. So I always said in my classes when I talk that part of the cost is what we do, we pay. A bigger portion of the cost comes from what we don't do. We don't really take care of it. And you can really use the concept of the cost as a spending or investing. Again, the boundary between spending and investing is very blurred. Nobody really gives that much attention to it. But I do. I like to really bring them up, clear them up, put them out there, and then explain them the way that it should be. So here is the direct cost. Means out of the pocket. And you can see that the number is quite significant. So anywhere about 10% actually say that they don't, but 90% have this type of escalation. Actually, the portion say that they do have cost, but they don't know how much. So by any measure, quite significant proportion actually pay a significant amount of directly towards the cost of care. Next, please. This is the hidden cost. The hidden cost is, again, portion of that. We're not talking about the emotional cost, that comes later. This is really unpaid workers. There are two estimates here, and I wanted to put both of them. The first one is in 2017. It says about 18.4 billion hours of unpaid, and they put a moderate figure per hour. What is the moderate figure? The moderate figure is really the average of the wages of those who provide care. And again, in their calculation, it's somewhere about $13 to $14. And they come up with this number of $232.2 billion. But the other study, which is not that really different from the first one, puts that almost as twice as much. They talk about 34 billion hours of work and put a number of $13.81, $13.81, and they come up with a figure of 470 billion. You will find that a lot on the website, on different internet locations. That is almost like $500 billion of unpaid workers. Next one, please. So again, if you really look at that, how the caregivers, what is the really take on that, they're really impacted by it or not, 85% are impacted. About 38%, a great amount, and about 47% a moderate amount. So again, this is based on the kind of direct cost. So a significant 85% of caregivers' lifestyle has been impacted by that, quite significantly. Next one, please. So this is the hidden cost. Again, on the subject of hidden cost, the percentage of US caregivers whose job have been impacted by the task of caregiving. About 46%, they said that, that doesn't really impact their jobs. So that leaves another 54% who have been impacted. And these are the variety of the impacts that they talk about. And if you each one of them, you take them and you try to kind of translate them, interpret them in terms of what was the really direct cost of it, definitely there is quite a lot to be really, we can come up with. Reducing, the hours of job, change, the shift, or the schedule had to increase hours, but probably those who've been impacted by needing more, income in order to pay for the expenses. And sometimes, it comes to resign from the job or change jobs and a variety of issues that they've been facing with. Next one, please. Okay, this one is again, I've got a bunch of other data like that, but I thought this one can really give us a way of looking exactly to see that how the economic and social condition of caregivers have been impacted. The first one is about employment. So 60% of caregivers are employed. That's really the number that you saw. The next one is the number of hours worked. Again, so you can see that you look at the portion of that is about maybe the 56%, that's 40 hours or more. So they're not only they're working, and they're working quite hard, most of them. The other one is about self-employed. So again, a portion of that, 70% of self-employed, but majority of them, about 79%, are not self-employed. The next category is about the workplace benefits. Again, one of the things that we have to really think about when you think about how we face and deal with our own problems, a big part of that is that we have to think about changing the model, the paradigm, the way that we go about it. And in order to go in those directions, we have to think about what is it that's currently happening. And these type of studies are really a window of looking into what is happening now. So these are the workplace benefits. So flexible working hours, about 53% have that, paid sick leave, and then paid family leave. Again, if you really look at a program to help caregivers, information, other things, only 23%, and telecommuting, they have only 22%. These are the structural issues. These are the issues that when we think about our problem, the same thing actually is about taking care of our own children. How do our workplaces embrace that? We call it, work-family balance. I think the work-family balance right now for most comes to younger age couples who really have, difficulty, challenges, take care of children. And if you think about, how the population is changing in the years to come, not long, 10 years, 20 years from now, then we have to really think about work-life balance in those new dimensions in light of those changes. So the other one again is asking that what is really that they really like. So we say that the financial, I can't really even see it myself here, the most preferred financial support again. As you can see it, that the program where caregivers are paid some hours of care, and they say the income, so some really like to have, tax benefits because of that. It's a very fair request, and unpaid, family paid, so that should be included. Don't forget, the support ratio is shrinking from what it is now to a third of it, in about 20 years from now. And then obviously, a significant number of people do not have any particular opinion at this time. And that's also very important. Next, please. So this one is a kind of interesting picture because if you really look at the code that we have, so we're asking about the economic, physical, emotional, and other burden of caregiving. Again, these data come when they're available. This was from the AARP in 2015. And if you look at the code really is the difficulty, all these questions that we ask, it goes from not at all, which is 1, and the color is blue, to very high, where the color there is, the other end of the spectrum. So if you really want to see the difficulty or the escalation of the difficulty to be high or very high, then add the very last 2 colors on your right-hand side together. So that will really give us, a better way of interpreting this graph. So difficulty with activities of daily living. So if you really add these 2 together, you're talking about, 23%. Burden of care, that's really interesting, because if you look at the burden of care, you add these two together, you're talking about 41%. If you take the physical strain, we're talking about almost 19%. Financial strain, we're talking about 18%. Emotional stress, that is about 38% if you add them together. And then again, medical, nursing difficulty, and so on and so forth. So these are the kind of roots of some of the issues that we have, which should really inform our public policy, should inform our community collaboration, a lot of areas that really bring up. Next one, please. So here are some of the, what I call, maybe policy issues or suggestions, or a look into what the future really entails for us, what we have to do, maybe a task list. So these are important. Working conditions and work-related issues. We really have to look into our existing work environment and change them, improve them, because let us not forget, for every 2 kids that is in our community, we have 1 person who's 85 or older. And by the way, the need for care doesn't really start from 85. It's much before that. So this is one particular area of attention. The other one is work issues and working condition for paid caregivers. That's another aspect of the, because we do have, and we have groups of people who actually, and many of them, I actually even work with them and know of them, some of the groups that are paid workers, they have their own union, and they've been really working, in every county, in every area. And again, if you look at, the problems that they're facing, they actually even hire, family members as to be paid caregivers. There are certain criteria for qualifying for that. But that's another area that has to be looked at, how we can upgrade, their skills. There is a question about that. If you are a caregiver, you think you will continue that in your years of life. I didn't actually put that chart up for us. But it's significant that we say they would, another group say they would not. So we have to look at, we have to really wear the kind of hat of thinking, how these things will change and evolve in the years to come. Health insurance with a focus on coverage as related to caregivers and care recipients. We have to do that. We have a lot of issues, with health care that hopefully we can probably resolve them in the years to come and won't really be bothered by that. Community-based assistance with a focus on sharing resources and development. There is a part of this study when you do get, if you do get the actual study itself, you can see it there. There's a part that we use, the survey that was done in 3-4 different occasions with an interval in Santa Barbara. And they were very, very kind to actually, they gave me the raw data and I analyzed them, and I actually give them back to them with the analysis. There's a lot we can learn from the Santa Barbara County and the survey and the results of the survey. There's another maybe 30, 40 pages of that in the report that I wrote. And if you really download that report, you can read it yourself. So yes, it's very important that we work in collaboration together regionally. Develop a community focus on underserved families and communities. We got in the report, we have some issues about the financial status of the aged population. How are they going to be, and how are they going to be impacted by the burden that may be on them? Workplace development, we talked about that. We certainly need a very clear attention, focus on and unfortunately, we don't get that. I mean, I also work on early childhood education. I finished something recently. Hopefully will come out soon. But I really even don't see that we're not taking care of our young ones, and also, in the way that it should be. So we really have a lot of areas for focusing how to take care of ourselves in the very younger age or in the older age. So advancement of entrepreneurship, innovative thinking, this is really interesting area because we have enormous amount of potential yet to be unveiled and explored and discovered and used about the use of technology. So there is enormous potential there for entrepreneurship, for coming up with ways of really helping people in that age. And so that's another, kind of bright side of what future may bring us. And reaching and advancing and strengthening the international relations. I mean, I don't know if you do, but I do watch a lot of time, Japanese TV, and I see that how they really, because they have one of the oldest population, and they really take care of themselves a lot. A lot of these issues are really preparation. Maybe I'll say just a few words to tell you exactly what it means. Right now, we are dealing with coronavirus. The average number of beds in the United States is 2.8 per thousand. In Japan is 13, in Korea is 12, in Germany is 8. Why 2.8 per thousand? And I want to tell you something else which may scare you, and I don't want to do that. In California, we have 17,000 beds for 40 million. That's less than half a bed, hospital bed per thousand population. These are issues. These are issues that we have to think about, prepare ourselves, deal with them earlier, not to be really, faced with them when we have right in the middle of the crisis. This crisis is coming. Call it crisis, call it difficulty, whatever it is. We're not prepared for it, and we have to be prepared for it. I'm talking about, the long-term care, and unfortunately, we live in a time, that a lot of these challenges is, but maybe we can learn. Next, please. So here are two web links. The first one is on the Ventura Community Foundation link. And if you go there and you click on it, you can just download the report, and it's there for you to read it in your own time. And the other one is a link to our Center for Economics of Social Issues. Please visit that. We have on the right-hand side, when you go there, you can see that there are the database. The database is we have about 10, 11 domains. Each one of them are broken down into certain indicators. We collect information on national level, on state level, on city, and even zip code level. We actually put these things, when it comes to the city and zip code, on GIS map, which is kind of easier, more visual to look at. We're updating it because the new census data came out a month ago, and we really have a lot of trouble. We need a lot of support there, which obviously School of Management and our dean is very generous. So he gave us, the support, and we are doing that, trying to bring that updated. Now, please visit that. We also have a series of study, like a library again, on the same thematic issues. We have a lot of links to connections. If you're doing a study, you want to really connect to other organizations within Ventura County. It does have a lot of emphasis on Ventura County, but it also deals with state and the national level. So with that, I am going to stop and just wait to see if there's any question, and I'll be glad to answer that. I don't see any question. Maybe I can hear it, or maybe Stephen can help me with that.
Absolutely, yeah. I'm just opening up the chat right now to see if any questions have come through. It doesn't look like anything right now, but maybe we'll just give it a couple seconds here. If anyone has any questions for Dr. Damooei about the presentation or anything that they want clarification on, some more information. Like Dr. Damooei said, I will include both of those links in the follow-up email, so you can have access to the study and to the center's website. And then the recording of this presentation will also be made available for reference as well. Okay, Dr. Damooei, it looks like you might get off easy. It doesn't look like there's any questions. Oh,
no,
okay.
I have a question.
Here we go.
No, I have a question here. Let me read this one. This is, do you see any possibility of global mobility being a part of the solution to our problems of taking care of our aging population? And I think Loredana is asking that. Okay, well, definitely. We should really be looking in these kind of new light. Because the problems that we have most of the time, again, I go back to our pandemic, we're dealing with that. it's really, we can deal with these issues much better in the global context. So yes, we have to really try to really go in that direction, because most of our problems are not just our problems, the problems that we have globally. I don't know if I really understood that and responded correctly to your question, Loredana. If not, please do ask me another question or ask me to clarify that further. Oh, School of Education. Thank you.
Okay. Great. Any other questions? You can throw them in the group chat.
Okay, Loredana is saying that I mean changing our immigration rules to allow more people. Okay, Loredana, I got that a little bit better now. Let me just talk about that. That's a very, very good question. So the question is this: we talk about having an old population, and again, the reason that we have old population, if you look at the fertility rate for keeping population constant has to be 2.1. And we certainly have a lot less than that. So there is no doubt that, we have one end of it is that the number of people being born is shrinking. That's one part of it. The other part of it, which is good, that we can actually live longer because of the healthcare, other issues that we have. Now, bringing people from outside, the question is that, if we allow immigration, certainly in kind of short and medium term, that will definitely provide. For example, let me just tell you one example. I did a little study, was it like 2-3 years ago? I can't remember, the number of years go so fast, about immigration. And what really came out was that in Germany, because Germans are very receptive, to immigration, not all the general population, but definitely the administration. And there were quotes from the heads of the industry that these crises in the Middle East and the immigration of Syrians, because Syrians were young and also educated, is the best thing that can happen to German economy. And they had figures to support that. Yes, that is definitely true. I think in various dimensions, we have to really welcome this. Number one is that, yes, we can have people coming as they've really come. For example, if you see that California may be a little younger than other states, it's because of, we have got immigration here. So it does provide, help. But here is another aspect of it. And the other thing, we can talk about immigration in various slides. But the other side of this discussion is this, that where will that really take us? Globally, we'll probably see that shrinkage is happening. Let's just be realistic about it. The immigration may definitely help, but it's not going to change the equation that much. Yes, the answer to your question, immigration provides solution, provides a short-term and medium-term solution, and immigration has many other positive aspects. So I would definitely think it's a very positive policy. I hope I answered your question better now. Thank you.
Great. Okay. Well, I don't see any other questions coming through, Dr. Damooei. So I want to say thank you on behalf of everyone that's on the webinar. Thank you for joining us.
My pleasure.
A huge thank you to Dr. Damooei. As you can see on the screen, our next presentations next week on Tuesday, March 31st at 10 a.m. Jody Skandarian will be presenting on staying productive while working from home. And then Thursday of next week at 10 a.m., Jim Cathcart will be presenting a presentation called Thinking About Rethinking. So I hope you'll be able to join us for those. Again, big thank you to Dr. Damooei and to everyone on the call. Stay safe and stay healthy.
Thank you, Stephen, and thank you all. Have a wonderful day. Safe and healthy. Bye-bye.